Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily.
And my name is David. Today, we will be discussing systemic lupus erythematosus, which is also commonly abbreviated to SLE. SLE is a chronic systemic inflammatory disease affecting multiple organ systems such as the skin, joints, kidneys, heart, blood-forming organs, nervous system, and mucous membranes. It is an autoimmune rheumatic disease, while the clinical manifestations are variable from individual to individual.
There are two types of lupus, which are systemic and discoid. Systemic is the more severe form of the disease. This can affect any organ or system of the body, while discoid is a limited form of the disease. It's confined to the skin, producing raised and scaly lesions. This rarely develops into SLE. It's primarily involved the neck and face. However, sun exposure may incorporate involvement of the trunk, the upper extremities, and the hands.
The etiology is unknown. However, interplay of various factors have been identified, such as immunologic, environmental, hormonal, chemical, and genetic factors. Other predisposing factors noted are mental and physical stress, strep or viral infections, exposure to sunlight or ultraviolet light, immunizations, pregnancy, and abnormal estrogen metabolism. When discussing incidence, it's commonly known as the disease of young women since it's commonly seen between the ages of 15 and 40 years old, and it impacts women more than men. When discussing race and systemic lupus erythematosus, it is more common in African American, African Caribbean, Hispanic American, American Indian, and Asian than Caucasians. First-degree relatives of patients with SLE have more of a chance developing SLE than general populations, indicating hereditary factor.
Now it's time to run through some of the most common signs and symptoms. These include, but are not limited to, a low-grade fever and fatigue, arthralgia and/or arthritis, skin rashes, such as the classic butterfly rash appearing on the cheeks, bridge of the nose, forehead, chin, and neck, pulmonary involvement, which can occur, such as pleurisy, pleural effusion, chest pain, difficulty breathing, or coughing, anemia, kidney involvement, such as lupus nephritis, sun or light sensitivity, which is also known as photosensitivity, hair loss, Raynaud's phenomenon, and mouth, nose, or vaginal ulcers. It is important to note that an individual with SLE can also have nervous system involvement, such as seizures, headaches, peripheral neuropathy, cranial neuropathy, which occurs when any of the 12 cranial nerves are damaged, cerebral vascular accidents, or psychosis.
Now that you understand what SLE is and the common signs and symptoms associated with this condition, here's a quote from Dwayne "The Rock" Johnson. "Success at anything will always come down to this: focus and effort. And we control both. You control that final frontier, warriors. That focus, that effort. You have to put them both towards this exam. Go all in. Your dream is worth it, and you are worth it. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow.